Lots of questions. We
Lots
need to get through them, yeah.
We do indeed, and there's some really, really interesting ones and some very sad ones as well, so we want to get to as many as we possibly can. We'll start on the topic of anxiety, because one of the overwhelming issues that most people actually got in touch with was anxiety. So I'll read this one from an anonymous emailer who contacted me. He said, I suffer from anxiety, and only recently, over the last 2 years, has become stronger and stronger. It affects my sleep, and I keep thinking of the problem over and over, and it is really starting to get on my nerves. This usually revolves around my love life, seeing my ex with her new boyfriend, or dealing with the recent breakup. I feel like it's the end of the world, and I would never find anyone, or they would never be interested in me, even though I know it's not true. So he wants to know what tips you can give him to combat these kinds of thoughts.
Okay, so what I get a sense is there's possibly two things going on, because one is around anxiety and the worry and the lack of sleep, but also there's this, I get a sense that sometimes when he's thinking about the new boyfriend, there might be anger there, and then there's a lot of these beliefs around nobody will want me, and they're more around sadness and about loss, the loss of a relationship. So quite often anxiety and depression can travel together, and you've got to figure out what it is that is the true sort of origin of the person's distress. So a good assessment is always necessary. So if you imagine like anxiety, like imagine a pair of lenses on the world. In anxiety we filter things like threat, and in sadness we filter things like negativity and sadness and loss. So I do think there's a lot of loss there, and that loss over time is manifesting itself as anxiety and stress. So just to get a sense of like it's so there's two pieces to that, I believe, and what I noticed too is there's a transition, and in life we all experience different transitions. We might leave home and go to college, or might leave college going to work, or we might be made unemployed, or our relationship status might change. So during periods of transition, our stress increases and our anxiety can increase. So things that we can do about that is to try to understand, one, what do I need to do to mind myself during periods of stress? So if you tackle the stress, then it won't tip into anxiety. And then it's really about, in anxiety, and a lot of the questions are around anxiety. Yeah. There are many different forms of anxiety. So the assessment is critical. Like, is it generalized anxiety? That's worry, 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 worry all the time. Or is it panic attack? Like 1 in 10 people will experience a panic attack in their whole lives.
And it's very high.
It's very high, yeah. So say there's like 40 people in the office here, at least 4 people will have experienced panic attacks already, we know that. Yeah. So it's really prevalent. And they're incredibly powerful, incredibly terrifying, but they're not dangerous. But people don't, if you experience a panic attack. Yeah. So what I'm saying for this person here, it's good, we might call all the ladies, because it's good to give a name, anonymous name, because we'll just call all the girls Mary and all the men Pat. Yeah. And that way we can This is Pat, yeah. So Pat's concerned about, what I would be concerned would be around Pat's beliefs. Because if Pat's saying that I would never find anyone, or they would not be interested in me, even though I know it's not true, that's a belief that people would not be interested in him.
Yeah. So it's a self-esteem thing.
It is, yeah. But when that belief is activated, or that thought is activated, so nobody will like me, no one will love me. If that thought is activated, his mood goes down. Mm-hmm. So I get the sense there's both low mood and anxiety. That piece of not sleeping over 2 years, and it'd be interesting to know, because I suspect he's ruminating and thinking about past events and going over past events. So, and
how do you stop yourself from doing that?
Okay, so with rumination, it's like identifying. Sometimes so you can think about it this way, yeah. Think of it, you can play it like a game of tennis, where you get the thought and you bash it out.
Yeah.
Okay, and you use cognitive therapy to do that. Or you can think about it in the context of mindfulness, where you're not caught up with the thoughts. So if you imagine the Matrix movie, do you remember when he was able to, all the bullets were coming in and he was able to stop and sort of identify? So that's like in a mindful moment, you have to identify the thoughts and say, I'm not going to get overwhelmed with these thoughts. I'm going to ensure that these thoughts are not going to overwhelm me, and I'm going to let them pass by. I'm not going to engage with them. Yeah. So that's sort of, now either mindfulness or CBT, cognitive behavioral therapy, thinking and doing, take practice and work.
Right.
Okay.
And mindfulness and cognitive therapy are things that all people who are experiencing anxiety could use.
Absolutely, because they're so we talk about the National Institute for Clinical Excellence, and in my book I really focus on evidence-based tools that work for anxiety, depression, low self-esteem and anger. And because my role as a scientist practitioner, as therapist, is to give people tools that really work in a jargon-free, accessible way.
Yeah. If we just move on to a different topic, a lot of people actually contacted to me about medication as well, and about whether it works or not. But a lot of people who are already on medication contacted me. So one example from a commenter called Melanie: I've been diagnosed with borderline personality disorder and PTSD, which is post-traumatic stress disorder. I also am suffering severe depression. I'm on medication. It's been increased recently. My question is whether I can ever have a normal life.
Okay, so there's three components there. There's post-traumatic stress. Post-traumatic stress is where a person has a very big traumatic event in their life, and it's characterized by intrusive thoughts, thinking about the event when you don't want to think about it. It's characterized by avoidance, so avoiding the situation, or avoiding thinking about the situation, or avoiding talking about the situation. And it's also characterized by hyperarousal. So if you hear a loud bang, you'll jump and be jumping. On top of that, the person's talking about depression. There's a lot going on here now for this individual, because it's quite an unusual profile. Depression is a sustained low mood over a 2-week period. People are often confused about depression. Depression is defined as a sustained low mood over a 2-week period, with thoughts of feeling hopelessness, maybe thoughts about suicide, with thoughts of lack of concentration. So you have biological symptoms of depression, how your body responds by overeating or undereating, or waking up early in the morning. And this person is talking about borderline personality disorder. Now, I don't know if that's been formally diagnosed. That's a complex presentation, because it's around how a person forms relationships, and often that's around early relationships. And one of the key building blocks in our human life is how we form attachments. How do we attach? So people quite often in life have healthy attachments, or where they have a close, warm relationship with their primary caregiver. It's usually their mum. But it doesn't have to be. You need one good person in your life, no matter how much trauma you experience in your life. And that can be a grandparent, or an aunt, or an uncle. Most people need one good parent, and that really is a solid building block for going on. For sometimes people with borderline personality disorder, they've struggled to have that one good person in their life, and they find it difficult to emotionally regulate. So there's loads of different things going on for this individual, and sometimes it can be early life traumas such as child abuse can be present. So if that's the case, in the HSC National Counselling Service, it's a free service for those that have experienced childhood abuse, and the length of the waiting lists are not as long as they used to be. They're anywhere now between 3 and 6 months, but given that it's a lifelong presentation that people have had since early childhood abuse, there's now a really good long-term therapeutic intervention, and it's free and accessible, and it's nationwide as well.
And just on the issue of medication, I mean, do you think that most people can get by without it? Most people who have mental health issues can get by without it?
Okay, so this goes back to a good assessment, good intervention. I think there's a role for both. It depends on the presentation. One of our commenters there talked about psychosis, and in psychosis where there's a thought disorder, and so in mental health there's some conditions that are what we'd call severe and enduring mental health problems, and they can include bipolar disorder and psychosis, and medications have a significant important role in that. And in the area of psychosis, early intervention with cognitive behavioural therapy is shown to work as well. Again, really going back to what are in the National Health Service, they use the NICE guidelines, and it's following those NICE guidelines gives the best outcome for the individual. So when it comes to medication, I think people in therapy often ask me, Eddie, what's the story here? I've been prescribed medication, should I take them or not? Or I'm on medication, I'm thinking about coming off. So there's a pros and cons, and I discuss it. But the pros and cons of medication are, it depends for the individual, but certain conditions like bipolar, psychosis, it's critical about medication. When it comes to trauma, I think medication has a lesser role, because I think trauma is an event that happens in an individual, and how I often see medications are external to the individual, and the control is external. Whereas by learning good thinking tools and good doing tools and mindfulness and all those and exercise, then they're you're taking control of the situation. For example, in depression, there's really strong evidence for mild to moderate depression that physical exercise, 40-minute sessions out walking or running, is the equivalent of antidepressant medication. So what I'm saying to people that, I would be, and particularly around panic attack, I'd be really focused on giving people really good tools that are internal to them, that they can tackle their panic and anxiety and move forward without the use of medication.
There's a question that we've just had come in here while we've been live, and if you do have any questions, you can still tweet them at us. There's still time left, or you can send them to tips@TheJournal.ie. This is a question from a reader who said, how can you approach taking a break from work for mental health reasons with employers? So I mean, obviously it's something, mental health issues, there is still a bit of a stigma attached to. A lot of people are still very embarrassed about it. How can they approach it?
Well, there's two ways. It depends. Like, if the person doesn't approach it and they feel that they need to take a break, if there's no intervention, they may, get sick and they may be off. So, for some people it could be they go in under a guise, they go to their GP, have a positive relationship, and the GP signs them off work. But the GP can say for medical reasons without actually giving the reason. So some GPs will do that, and they're very supportive to their patients around that. So that's one way of doing it. Obviously, getting a GP to sign you off would be appropriate, and having that discussion with your GP. But for some employers, it's not necessarily for them to know that this is why you're taking the time off. For others, it may be necessary to know because you could access more supports. And that's an individual judgment call for the individual, because some places can be very supportive to the worker, and possibly going back into work can be done on a phased basis. So quite often I would talk to people about maybe if they're been out of work for a period of time, like this person who decides to step back and do some really good skills building, and then it's going back into work, that they go back in a phased basis.
If we just turn to another topic now, a lot of people, again, apart from anxiety, a lot of people contact us about the work-life balance. Two women in particular, two middle-aged women in particular who had questions, and they're both mothers. One said that she works very late night shifts, and she hardly gets to see her children. The second woman says she's a 40-something mother of two children, a full-time job, and both she and her husband, they work very long hours, between meals, housework, homework for the twins, and my own work. After normal working hours, I feel totally drained at the end of each day and have no social life to speak of. She said she and her husband, they never, and she said, I mean never, not rarely, go out together as babysitting is costly. I realised recently I now rarely feel joy, mostly just stress, and I feel like I'm up against the clock every day. Do you have any sort of top tips? I mean, maybe 3 tips for someone to declutter their life, or to take a step back and sort of say to themselves, these are the important things.
That's really common, because sometimes that's a hangover from the Celtic Tiger, where people have got caught with high mortgages, have gone into negative equity, have young children, and are often commuting.
There's a lot for people to deal with nowadays.
There's a lot going on there. And really, when it comes to stress, I think about it in different ways. Like, I think about it in the 3 Ds, like deal with it, delegate it, or dump it, right? And it's maybe evaluating what is important in that person's life. What is it, like, there's a disconnect. It's almost like the relationship, the adult relationship between herself and her husband has gone in separate ways, and it's about how do you can start reconnecting. These are ways that a person can reconnect. So it's maybe looking at some support around that. I know childcare can be expensive, but if there's, somebody could come in for an hour, and husband and wife go off for a walk for an hour. It doesn't have to be big bang events or like sort of weddings, or but something small and regular. Maybe going with the children at the weekend, and having those connect moments where they can connect. Because really, for me, that what I hear there is we've disconnected. I want to reconnect. And where about this couple that can they talk about that? Can they face that? Because that's really their challenge, is about reconnection.
And another one that was a relationship issue, obviously in slightly different circumstances. A woman called Norma emailed me, and she said, my husband is in his early 60s and has dementia. I'm finding it very difficult to keep our relationship from deteriorating. Have you any advice for her?
Yeah, so that's really sad, because dementia is it just robs a person of their personality. And what I hear there is a person who loves someone all their life, and then there's a disconnect, a physical disconnect, because of the dementia is taking this person away, and it's robbing the person of their relationship.
Yeah.
And so I'd encourage around the Carers Association, getting family support, getting good information on dementia and Alzheimer's. Having discussions now, with their loved one before the dementia, where they're currently in a position to make decisions, and saying what are the decisions that people make. Because in life we don't often make decisions until there's a crux point, until someone fractures their hip and goes into hospital, and then they're looking at potentially residential care, nursing home care.
Yeah.
And what I'd say is, have these conversations with your adult children in advance. Make decisions about, to be cared for at home for as long as possible. But to me, there's a loss, and the loss reflects the loss of the relationship and stuff like that. And it's maybe focusing on, celebrating because people with dementia, particularly in the early phases, have islets of positive mental health, where the dementia process is less, and it's reconnecting on those occasions.
Mm-hmm.
Yeah.
I think I've read somewhere before that good ways for families to connect with someone who has dementia is to bring them back to their past. Is that something that you might recommend, that you just maybe go through old photos together?
Yeah, that can be really helpful, and that's called reminiscence therapy, where the person would go back to old photographs. But that's often done in later stage dementia or Alzheimer's, because the person will have lost most of their short-term memory, which is their ability in the now. Now that person is in the early stages, so reminiscence or doing old photograph work wouldn't necessarily be for now, it could be for later on.
Right.
But for now, during good periods, it's actually enjoying the now, and when things are going well, and doing things like going up to Dublin, go for a show, and really enjoying things that they really previously enjoyed.
Great.
Yeah.
There's one comment that I definitely want to make sure that we get to, because it's very sad, and we talked about this just before we went on. A commenter called Noelle Robb, a really tragic story. She said that she's had anxiety and depression after the deaths of two of her children, two daughters, in 2012 and 2014, just last year. She said, "I'm not coping well at all, I'm really struggling." Is there anything that she can do to ease her pain?
Okay, so there's a couple of things, like we don't have a lot of detail there. Like, for example, if mum witnessed the children dying, then she may have a feature of post-traumatic stress.
Yeah.
There's profound loss there. And one of the way with grief and bereavement, it's very different than a depression and an anxiety, because that's a complex grief, a complex bereavement, and the only way to get through grief is you have to go all the way into that pain. You can't avoid that pain, and that's a really hard thing to do, and it's to be supported in doing that. And I'm two boys, and I just couldn't imagine my life without my own children. So that's what you're experiencing, and I think it's somewhere about finding a compassionate voice for yourself, that there's no pathway. If you do this, then suddenly you'll have everything will be all right. And life isn't like that. That's such a profound loss.
It's different for everybody as well.
It is, and you have to find a way. How do I carry that loss with me without overwhelming my life? And I think that's the question for you, Noelle. How do you carry that loss with you so that you're not totally overwhelmed? And to say, if I am overwhelmed, that's where I am at the moment, and try to build up those bits that you're just holding on and that you're coping. Yeah.
We've talked already a little bit about, to do with the woman and her husband having dementia, but when it comes to the family members of people who are suffering from mental health problems, I think sometimes that can be overlooked a little bit. So we have one example here. My partner's brother was diagnosed with paranoid schizophrenia 3 years ago. His brother does not comply medically, which means his brother lives a chaotic lifestyle. This is very difficult for my partner. I'm concerned, though, that he has internalized all of his emotions to do with his brother's illness. This woman, she's very concerned about him. She says, "We love each other deeply. I'm concerned he might be depressed," but she doesn't know how to approach him. She said he's a typical Irish man when it comes to health, and he obviously doesn't want to talk about it. What can she do to get him to open up, or maybe to seek help?
Well, sometimes you can try and set the conditions for the help, but sometimes people just don't go. Like 9 out of 10 people that will contact me are women. And if they're contacting me, if they're concerned about their husband, it's the wives and the mothers that will contact me. The guys won't contact me. Yeah, they will. They'll ring and say, I had a phone call this morning. I was on the radio, and then afterwards I had a phone call saying, listen, Eddie, I'm concerned about my son, and he's 45, and the mum is like 70. And, so it's very prevalent. And I suppose the piece there around that's such schizophrenia, and a person that's not on medication, not taking medication, can live a very chaotic lifestyle. And you don't know whether there's other siblings involved, or that's the only brother, or are the parents alive and he's concerned about the parents and stuff like that. He could be very angry towards the brother. He's saying, like, look, you're putting our family through hell here, even though you're unwell. That's the reality. And what a lot of people do when they have mental health issues is, and I'll just step away a little bit about anxiety and depression, sometimes carers can keep the problems going. And so we talk about smart caring in the book, where I look at what people do that can sort of not keep the problem going. Because one of the key questions for any mental health difficulty is, what keeps the problem going? And if you could target that, then you can plot out a solution.
And there's one quick one that I want to get to just before we finish up, and it says, a commenter was asking about interaction with animals. We're big animal lovers here in the journal. He wants to know, in his years as a clinical psychologist, does he believe a strong link between regular interaction with animals and positive mental health, i.e. a person with schizophrenia owning a pet or two resulting in more good days than bad? So I mean, has it been proven in any way that animals are good for you?
There is really good research out there, and first of all, like, animals give good routine because they need feeding, water, walking. So you can give someone in a chaotic lifestyle some structure, and gives them attachment. And it's like, I did some work with homeless people and recently, and you could see the animals, and because animals basically give you a connection that they're not necessarily going to hurt you, where the world has hurt you. So we've worked, and I've been in some projects where we brought animals into learning disabilities or facilities, or into the work in hospices and the work in care areas, and they can bring a lot of joy. A lot of people can connect with animals. They break down it's non-verbal, isn't it, really, animals. And I'm a dog lover myself, so I'm all for animals, but there's good evidence to support it as well.
That's great. That's all we're going to have time for the moment. We've passed the 20-minute mark. It flew by, actually. I'm sorry that we didn't get to everybody's questions. We were overwhelmed with the questions, actually. But Dr. Eddie Murphy has kindly agreed to answer some more of them that we didn't get to afterwards, either by email, or he might come into the comment section afterwards and answer a few more of them. I'd like to thank everybody for tuning in. Thanks a lot, and take care.
Thank you very much.